Okay, thank you, Mauro.
Welcome.
Before I start, I will add to your introduction that I'm here also as a former student of Roma Tre University. Okay. Thanks to the organization once more for being here today. I will give you an overview of microbial contamination contact lens cases. Okay. If you are a good observers, and it's a difficult task, maybe you have noticed that I used the same picture that Professor Lore used yesterday, and let me thank him once again for that. And I did it because I want to underline that contamination of contact lens cases is just a branch of contamination in contact lens wear, but it may be one of the most important factors involved. In this recent review of Wu and colleagues, the use of contact lens contamination, as you can see, was found in almost 1 out of 2 storage cases. And also a strong relation was found between contamination contact lens cases and corneal diseases, including microbial keratitis. Sorry. Okay. But why it is possible in contact lens case? Contact lens case should be the place where disinfection occurs, so probably the safest part of contact lens disinfection. And this happens because biofilm formation enhances microbial resistance to contact lens solutions. Biofilm is a group of microorganisms in which cells attach to each other and often to a surface, that in our situation is the storage case, and these cells are embedded within a self-produced matrix of extracellular polymeric substance. How can we prevent this inconvenient microbial biofilm presence? There are 2 main strategies, and the first involve patient education, so involve also you as practitioners, and for improving compliance and case management. So it is appropriate to give clear instruction of hygiene first, so to wash hands, and how to take care of the case. And this method was found very useful and effective, so to rub the case with a toothbrush, for example, to rinse it, to wipe it, and to dry it, let him dry. And also to replace it regularly, so almost once a month. Forget about the guidelines of several associations. And the second part of the strategies involve the research, particularly on material used. Here I underlined silver-impregnated materials because it's the only ones available on the market now. And I want you to pay attention to the first 2, organoselenium polymers and these strange words, to DP and PGG, that are the most recent. And in fact, you can see that the first one is from November 2015, and the other one is on 11 March of 2016. So the research is going forward. But in the review, I also found that further studies are needed to establish the effectiveness of silver-impregnated cases. But actually, we did it. We did a research, an unpublished research, on the assessment, the ability of antimicrobial lens case in preventing specific bacterial biofilm formation in vitro in non-habitual contact lens wearer model. I present you these friends of mine, Pseudomonas aeruginosa and Staphylococcus aureus. The research investigated the ability of these cases. We have 3 antimicrobial cases. The first one from Shalcon, here in Italy. The second one is from Ciba Vision, microblock, registered trademark. And also we have HiCleans from Southland. The last one is a common contact lens case, non-antimicrobial. We use a simple multipurpose solution and a soft contact lens. Maybe I will skip part of the protocols because maybe it's too much. I just want you to know that we used as an inoculum for the cases the contact lens itself, instead of pouring directly the microbiota inside the cases. Okay, these are our results. We found that 11 out of 64
Alfredo, scusa, se puoi arrivare alle conclusioni, grazie.
La prossima slide, grazie Pietro. If we found that 11 out of the 64 cases were contaminated by Pseudomonas aeruginosa only, and 10 out of 11 presented contamination was this kind of cases. Just one other case were contaminated, and the unknown antimicrobial just at one time. So a brief discussion before the conclusion. Contact lens case design influences the rate of contamination and is in accordance to literature. The higher rate of contamination found in ex vivo studies can be related to other factors like environmental factors and poor management by wearers. The differences between this study and other in vitro studies are related to the diversity of experimental protocol design, as I said before, particularly for the bacterial inoculum. Conclusion, in this model, so in non-habitual wearers, 1 day, 2 days per week maximum, the replace of contact lens storage case every month, we found that there seemed not to be a convenience in using antimicrobial cases, and that is not necessary to replace the multipurpose solution inside the storage cases for both antimicrobial and non-antimicrobial cases. Here there are some acknowledgements, so thank you for your attention,
Grazie.
and I hope you enjoy your workshop.